We've experienced a significant increase in the demands of support for survivors that are living in the community. Our community support and outreach program have been operating over capacity, and we have seen an increased demand for supports across all of our programs areas, with the exception of our crisis line, where we had seen a concerning decline when the emergency order was first declared.
I can say we've been busier than ever before. Busier, the needs are so there. The needs are so there. And as I've said before, the fact that they were coupled with this pandemic added another layer to the difficulties that present themselves for women normally to get access to services.
Um, so we were getting more calls than I think we were used to getting, which I previously mentioned. And we're also hearing more stories about women's abusive partners just ejecting them from the home. That threat to eject someone from the home, or the actual sort of forced eviction of the other partner from the home, was a control tactic that we were seeing was being used quite frequently by abusive partners, both at the start of the pandemic, and we've seen that in an ongoing fashion pretty much up to this day, where we've just recently gotten calls from women who were thrown out of their own homes by an abusive partner or ex-partner.
I can share the different ways that violence is showing up in the lives of survivors, such as abusive partners sharing misinformation about the pandemic in an attempt to control or frighten folks, including information like that the shelters are closed, contaminated at capacity, are unhealthy or unsafe. Survivors who have had essential items such as hand sanitizer, cleaning products, masks, food, medicine, and other essential items being withheld. Also, we heard about experiences of social and physical distancing being used as a means of separating people from their friends and their family members. And then also heard from survivors living with a disability whose partners were also their caregivers, that were using their overusing power and control over making decisions around their health and medical needs, and the medical and health supports that they needed.
C'est pire que jamais. Les femmes sont démunies parce que toutes les sources toutes les possibilités qu'elles pouvaient avoir auparavant, puis qu'elles n'utilisaient pas vraiment, sont encore moins présentes. Donc, la possibilité de quitter un conjoint parce que lui est au travail, c'est terminé. Tout le monde est ensemble dans la maison, dans le logement. Les enfants vont peut-être pas à l'école, le niveau d'anxiété, quelqu'un perd son travail.
And now it was like no time off, like no time to even call their families or have alone time. So I think that like mental health has really been affected of a lot of these clients, right? Like a lot of time they were able to somehow balance it, right? Like, say, okay, at least I have this time to myself, and then, over the weekend when he comes home or something, but now it was like non-stop, right? It's all there and everything, right? And a lot of our clients really had a mental health breakdown.